This isn't something that you can prepare for overnight. I think you've got to, at the earliest possible time when you think there's a potential threat, start working on multiple levels, obviously with our frontline staff to make sure that they feel fully competent and confident that they know how to identify a patient at risk for Ebola or with Ebola, that they know what to wear, they know how to isolate that patient as quickly as possible, they know how to ask for help, and that we have the ability to provide ongoing care if we do need to keep that patient or they test in a critical care setting.
I think we've all been a little stunned by what the CDC was calling lapses in protocol at Texas Presbyterian. It seems the more we hear that maybe there was no protocol in place or changing protocols. It's very concerning to think about the nurses and doctors on the front lines there.
Yeah, I would agree. You know, at a minimum, and again, we didn't see this in Dallas, and we don't know exactly what happened, but at a minimum, we know that the staff there did not feel safe. They didn't feel like they knew exactly what to do. The instructions were clearly changing over time. And given that this disease has a 50% mortality rate in the best of circumstances, everybody who interacts with a patient who has Ebola or is at risk for Ebola has to know exactly what to do and feel very confident. And they also have to be watched. You know, as you know, when you're putting your gear on and you're taking it off, somebody's got to be watching to make sure that you're not contaminated, and that was not happening every time in
How
Dallas.
consistent has the recommendations in terms of protocol from the CDC been in terms of your the preparations you're making?
Right.
How much are you actually listening to them, and how much you doing your own thing?
Right. So the recommendations have evolved, I think, as most people recognize. Part of our responsibility is to listen to everybody. So we're listening to the CDC. We're working very closely with the Department of Health in New York. We're speaking with other hospitals like Emory. We're following and reviewing the Médecins Sans Frontières, Doctors Without Borders guidelines. And the idea really is to get the best information as quickly as possible and implement that, recognizing that the state of the art may evolve and may evolve very rapidly.
Do you have confidence that other hospitals are going to be ready? I mean, I actually do have confidence that you can figure it out. I'm less confident that everyone. Am I wrong to be less confident that everyone else can figure this out?
There's thousands of hospitals in this country, and I think there's going to be variability in readiness and capability. You know, our view is, and I think the CDC is in a similar position, is that everybody has to be ready to identify patients, because somebody can walk into any hospital in this country from West Africa with symptoms that are consistent with Ebola. They have to be ready to identify that patient and stick them in a room and isolate them. At that point, though, in all likelihood, they should probably be transferred to, you know, a handful of centers in each state that are really ready to manage the patient and protect the staff at the same time.